At least 15% of Jamaicans who have diabetes end up with a foot problem. That's according to the Diabetes Association of Jamaica. Orthopedic surgeon at the association, Dr. Paul Wright, explains the reasons behind this.
When they go to the doctor, 60% of the people who go to the doctor doesn't examine their foot. And that is one of the problems that we have. Plus also the diabetics who are on 2 or more oral medication refuse to go on insulin. And once they go on insulin, then they would be okay, but they're just not going on the insulin. They're afraid of the injection, and therefore they have poor control. If you have poor control of your diabetes and you don't examine your foot, then you're going to have some foot problem.
Also, not wearing the proper shoes and cutting toenails regularly are contributing factors. But what's worse are the long-term consequences. Dr. Wright says the main complication is amputation of the foot, which affects 30% of diabetics.
Cut off the foot, and you either lose the toe, or you lose the foot itself, or they cut off the leg below the knee. Amputation below the knee is the most common treatment of diabetic foot problems that are not improving.
Dr. Wright says if a diabetic gets a cut or a bruise that won't go away after 3 treatments, then he or she needs to see a medical doctor immediately. He's urging diabetics to also examine their feet regularly. Meanwhile, Dr. Wright has this reminder for diabetics.
Use socks, cotton socks that are absorbable. Don't walk barefoot. Wear the proper shoes, because barefoot walking, remember the diabetics, when the diabetic foot, they're not feeling as often as they should. And therefore we try to tell them not to go barefoot, because barefoot, they can get cuts and bruises, not notice it, and then to use a mirror when they're examining their shoes.
With your health report, I'm Shamela Pullen wishing you good health.